the Journal of Child Psychology and Psychiatry, celebrating 60 years of empirical research, clinical studies, and systematic reviews. For details of our 60th anniversary celebrations, visit www.acamh.org/JCPP60. Follow us on Twitter with the handle @thejcpp and use the hashtag JCPP60.
So I'm Joan Asarnow, and I'm a clinical psychologist, and I'm a professor of psychiatry and biobehavioral sciences at UCLA David Geffen School of Medicine and the Semel Institute for Neuroscience and Human Behavior. Well, it's really an honor to be part of this amazing team and part of this wonderful journal. And it's very exciting to meet people from all over the world who are working to improve care for child and adolescent mental health. Well, I was first introduced to JCPP through my postdoctoral mentor, who is Michael J. Goldstein, a professor at UCLA in the Department of Psychology, and he was the editor for North American Submissions at that time. And now, of course, there are many Americans, in addition to folk from the UK and across the world here working on the editorial board. I think that's one of the most exciting things about JCPP is the fact that it does reach globally and it attends to issues that are global. I work in the area of suicide and self-harm, and I think, as you know, suicide is a major public health problem and leading cause of death across the entire world. And having an opportunity to work on a journal and to nurture papers from different parts of the world and that address problems and strengths that exist across the world is very exciting. Oh, I think it has grown enormously. Exposure to JCPP in the United States was fairly minimal when I first started out, and now people are reading it and enjoying it, and the research reviews and the scientific articles and the practitioner reviews and the annual reviews all contribute to a lot of excitement and enthusiasm and great thinking in the field. That's a great question, and of course you have to have a good life-work balance, but I really enjoy the work on the editorial board and having an opportunity to learn about different kinds of work that people are doing and to be part of this process and to contribute to science and to contribute to the health and well-being of children around the world. I'm working in the area of suicide and self-harm, and I would very, very, very much like to see us reduce the suicide rate. One of the most troubling facts in mental health is that the suicide rate has not declined, and that stands in sharp contrast to data on other sources of mortality. So, for example, in the US data, if you look at children between the ages of 10 and 14, we've seen a marked reduction in deaths from motor vehicle accidents. In contrast, rates for suicide have actually gone up and they've crossed. And that's led us to really raise a number of questions about why are we able to reduce rates of motor vehicle accidents, deaths, but we can't seem to shift rates of suicide deaths. And my work is focusing on treatment and working within large health systems to bring systems of care in that hopefully will reduce deaths from suicide and other sources of premature mortality.
To be part of the advancement of child and adolescent mental health, visit www.acamh.org.